We all have aches, pains, and odd sensations in our bodies now and again. Most of the time, we know that these are part of our everyday life, that they'll go away on their own, and we can ignore them. If they become more painful or uncomfortable or unusual, we know they could be signs of an illness, and we call them symptoms. Sometimes these symptoms just cannot be explained, and about 1 in 4 people who see their primary care physician have these types of collections of symptoms. In the clinic I did just yesterday, over half of the patients had this. They're called medically unexplained symptoms. Medically unexplained symptoms are really frustrating because the tests, such as an examination or blood tests and scans, are all normal, but you still have your symptoms. And an important part of getting better is understanding what the problem is. But in this scenario, neither you nor your doctor know exactly what's going on. The commonest types of medically unexplained symptoms can be anything from pain in the muscles or joints, back pain, headaches, feeling tired, feeling faint, having chest pain, having heart palpitations, having stomach problems. It's a very long list. Medically unexplained symptoms is not like other diseases. There are often loads of causes, and these often stretch back to childhood. I'm thinking of things like being ill as a kid, or having ill parents during childhood, or just having a tough childhood in terms of adversity or abuse, or having certain personality traits. We can't do much about any of these things. We can't do much about our genes or our parents or our health as kids. But this is where environment, upbringing, social stability, parental bonds are paramount, and it clearly goes far beyond spraining a muscle or catching an infection at one point in time. Often with people that have medically unexplained symptoms, physical and psychosocial stresses have occurred prior to the onset of these symptoms. Once a patient shows these medically unexplained symptoms, what I mean by that, again, these physical symptoms associated with mental health issues that just don't fully add up. There are maintaining factors which keep these symptoms going. What I'm thinking about are things like physiological factors. This is when some of our key bodily functions and pathways go awry. Things like dysregulation of our autonomic system, hormonal and immune dysfunction, and metabolic abnormalities. These are real changes to how your body functions. But again, this is a bit of a chicken and egg situation. We don't know if these changes come first and then you have symptoms, or if you have symptoms secondary to something that causes these changes. Other types of findings are social findings, like a loss of role and medical uncertainty, cognitive issues like symptom focusing and a complete intolerance of uncertainty help make these symptoms much worse, or behavioral factors that prolong these symptoms. This is things like avoidance behavior, not seeking help, all or nothing behaviors, and having very poor sleep hygiene. So while we can't modify the causes of medically unexplained symptoms, those things like your genes, your childhood, or your parents, or your relationships with them, we can modify these maintaining factors, especially the cognitive and the behavioral ones. So why does it all happen? When something in your body doesn't feel right, there's usually a bodily or physical cause. Stomach problems may be due to an infection, or palpitations may be due to a heart problem. If there's no physical cause, we can often understand and explain these symptoms when we look at how our thoughts, how our feelings and stresses affect our bodies. Medically unexplained symptoms aren't all in the mind, but neither are they all in the body. To understand them, we have to think about how the mind and how the body work together. We often think of our minds and our bodies as two separate things. They're not. They work together and they affect each other intimately. Research shows that there is a two-way communication between our brains and our bodies. This happens because signals travel down the nerves from the brain to the body and back again from the body to the brain. They communicate. Natural chemicals like hormones circulate in the bloodstream. Some are produced by the brain and affect the other parts of the body, and some are made in the body and they affect the brain and the way we feel. Every day, thoughts, feelings, and stresses play a part in making changes in our bodies. So for example, when we feel embarrassed, we blush. If we feel worried or frightened, it can cause an uncomfortable feeling and butterflies in our stomach. When we get upset, we can feel our throat tightening and causing a lump there. We also know that the way we think and feel can make us physically ill. So for example, feeling low or stressed makes any pain we have feel so much worse. That's why managing pain in people that are low and depressed is very, very hard. Long-term stress can make us more likely to have high blood pressure or a heart attack. A disease in the body can affect the way we think and feel. It's common for people to have a physical illness and to have physical symptoms that are not fully explained by that illness. This can happen for a number of reasons. Stress, or a physical illness, can cause emotional stress, which then creates physical symptoms of its own. Imagine someone with an illness such as asthma or emphysema who finds it hard to breathe at times. This can be frightening, which triggers the stress reaction. This makes them breathe faster and their chest feels tight. This is a vicious cycle, and it's created whereby breathlessness and stress each make each other worse. The breathlessness is then out of proportion to the illness that triggered it in the first place. Let's think about pain. A painful physical illness can make us feel depressed. This lowers our pain threshold and makes the experience of pain worse, and another vicious cycle ensues. Or even worries about our health. If we know that we have a physical illness, we may be more alert for bodily symptoms that could indicate that our health is getting worse. We might find that sensations that we would otherwise ignore, such as aches or pains, become symptoms that we cannot stop worrying about. We can give a name or a diagnosis for symptoms when they occur together in a particular pattern in people, or when they share a similar cause. Sometimes groups of symptoms commonly occur together to create a pattern of medically unexplained symptoms without any physical cause. So I'm thinking of things like irritable bowel syndrome, which causes troubling abdominal symptoms, or fibromyalgia. This causes widespread bodily pain and tenderness. First things first, this is tricky stuff. Anything that is rooted in a complex biopsychosocial history won't be solved in a 10-minute consultation. If you have a range of physical symptoms that don't make immediate sense, then you should have a detailed history, asking about symptoms, childhood, and family history. A physical exam is useful too, to exclude other physical conditions and basic observations, and a blood test would be pretty standard practice here. This helps to exclude common conditions that can sometimes masquerade with non-specific symptoms, things like diabetes, celiac disease, thyroid problems, or weird inflammatory conditions. How can you help yourself if you have these medically unexplained symptoms? Tackle your other stressors. Are there any other stressful things going on in your life that may be affecting how you feel? Almost 9 times out of 10, when I ask patients about stress in their life, they can directly link their symptoms to something that has happened in their past. Even more so, with irritable bowel syndrome, 50% of people credit the onset of their symptoms of irritable bowel syndrome to one acute traumatic experience previously in their life. These things matter. Can you talk to someone about these issues? Can you get any help or advice to manage the situation? By reducing stress, you might find that your symptoms get better and you feel better too. Get healthy too. If you feel generally healthier, you may find that your symptoms bother you less. Try to eat healthily and cut down on smoking and alcohol. Try to get enough sleep and have a regular sleep routine that you stick to. And do exercise regularly. This helps to strengthen muscles and makes us more fit. Don't overdo it, of course. This can make you feel more tired and unwell. Build up. Gradually take time to relax. This helps manage these symptoms. People who notice these symptoms often have very poor maladaptive mechanisms to manage stress and manage their difficult situations or feelings. This might mean making time for you to do something that you enjoy or that distracts you from your problems. Learn some relaxation techniques. This is really important. There are many self-help books and websites that help with this. Don't keep looking for reassurance and information about your symptoms. If you find that you spend a lot of time worrying about your symptoms, remember that repeatedly looking for reassurance or information is usually unhelpful. Reassurance often doesn't last long and the worry comes back very quickly. Similarly, spending too much time looking for information about your symptoms, such as on TV or in books or on the internet, can make you more convinced that there must be a physical illness to account for your symptoms. Again, I find this time and time again in my patients that have medically unexplained symptoms. They have always trawl the internet, and always think they have something horrible. The main options here are drugs and talking therapies. Antidepressant drugs, we use these to treat a range of problems, not just low mood, and it can really help with medically unexplained symptoms in a number of ways. Sometimes the symptoms are part of anxiety or depression, in which case the symptoms will improve if the depression or anxiety is treated. A vicious circle can be set up between symptoms such as pain and depression. Antidepressants can be helpful to break this vicious circle, and both the depression and the symptoms can and do improve. Some antidepressants can act as painkillers, and they may even be prescribed for things like chronic pain, even when someone is not depressed at all. And some antidepressants can even help to treat a range of medically unexplained symptoms, even when someone is not depressed. We're not sure how they do this, but the evidence does show that they do work. There are different types of talking therapies that can help. The choice of therapy depends upon the sort of problem and the type of therapy that seems to agree with you. The mainstay with all of these therapies is that they try to help with recognizing what makes your symptoms worse. They help you manage the stresses that might contribute and exacerbate these symptoms, and they help to develop ways of coping with and living with these symptoms. The mainstays of these types of therapy are cognitive behavioral therapy. This helps identify those unhelpful thoughts about yourself and your health, which can make your symptoms worse. Then there's psychodynamic therapy. This can be helpful when you've had these early life experiences that often play an important role in medically unexplained symptoms. And finally, problem-solving therapy or solution-focused therapy. This helps to identify and tackle specific problems in your life that seems to be making things worse. Most people who see a doctor like me with these types of bodily symptoms that aren't due to a physical illness are helped by talking about how their symptoms are caused and what they can do to help themselves. Some people have symptoms for a long time, especially if there's a lot of long-term stress, which is pretty much everybody, and if they have a lot of medical appointments and investigations. It's not always easy to understand that there may not be a single physical unifying cause for the symptoms that you experience, especially if doctors have spent a lot of time looking for physical illness. Even if you've had symptoms for a long time, there is much that can be done to help you live a better life and to avoid the unnecessary agony and treatments and investigations that come when your mind fixates on these medically unexplained symptoms. Thanks for watching. Till next time, stay healthy.